Hello, everyone. This is Veronica Brill, the Blenderized RN. I am just going to share my page, and then we're going to get started. Dr. Katrina Miller is waiting on the line. But first, I'm just going to introduce. Okay. First, I'm just going to introduce this. Okay, and you're in the corner. We could probably just leave you in the corner there. So welcome to the webinar. I'm Veronica Brill. I'm the Blenderized RN, and we'd like to welcome Dr. Katrina Miller. She's a family physician and an informatics specialist, and we're going to do a little Q&A with Dr. Katrina Miller. And if there's any questions that you guys send and we can't get to them, or it's outside of the scope of her understanding, I will maybe research them and I can answer them in another webinar. So questions or comments, please text 415-496-9245. I'll have that number available the whole time. I might flash back to it in a little bit, but I'll have that here, 415-496-9245. Please write that down. And then check out our group on Facebook. It's facebook.com/group/blenderizedrn. And the file section has a lot of great information on how to get started on a blended diet and recipes and basically references from the American Pediatric Society, kind of guiding you for your blends. And my website is up, blenderizedrn.com. And you can email me, veronica@blenderizedrn.com. And we would like to welcome Dr. Katrina Miller. Okay, so let me get Skype up to full screen view. There we are. Hello, you look beautiful.
Hi, Veronica, Blenderized RN.
Hello, Dr. Miller. Thank you so much for joining us. I really appreciate your time. And I've sent you some topics of discussion, and I thought we could just get right into the nitty-gritty. So the first question for you, as a medical doctor, a lot of parents have resistance from the medical community regarding a blended diet. It is starting to trend to more blended diets, but why is there such a resistance from the medical community for blended diets?
Well, before I answer the question, I just want to say that, first of all, I am so impressed with everything you've done, Veronica.
Oh, thank you.
You've started up Blenderized RN, and you and David and Little D have, a great life going, and you've been taking such great care of your son and have learned so much from it and are teaching people such great things with it. So I just wanted to say, first and foremost, I am so impressed with what you've done and what you will continue to do. And, you've been a great friend to me for a long time. And, it's just so terrific to see what you're doing. And I do hope that more people can learn from what you're presenting to the world. And I know they will. So
thank you. I appreciate that.
Of course. And I will continue to tell folks about Blenderized RN. And I know you just put up your website. I think it's all nice and up and running now, so people can go to blenderizedrn.com and find all of that. And more of your great webinars. You got a lot of terrific content out there for a lot of people to see. So, in terms of doctors, let's just think about who doctors are for a second. Now, we're all people, right? We are all people with fears and understandings and misunderstandings, depending on what we've been taught in school or by our family or by our religion or by our culture. We all have a different understanding of what's going on with anything. And doctors are definitely not exempt from that. And so you have to first off remember that the doctor you're speaking to comes from a certain background, a certain understanding, a certain type of education, but they are people, and they do generally, I'll say generally, want the best for any patient they see and want to work with the patient and the family in the best way they can. Okay, so I just want to keep that in mind, because I think some people think once you put on a white coat, you become superhuman and you're somebody that can't be spoken to, and you can't work with a doctor, but certainly, that white coat is just, one piece of clothing that when it comes off, they're your brother, they're your sister, they're your mother, your father, your family friend. And so keep that in mind. It's a matter of having an understanding with someone else that doesn't have the same understanding you do. And then let's go back a little further. Let's go back to what doctors learn in medical school. Okay, so medical school is a very traditional type of training, and we get very little nutritional education. And when I came up in medical school, which was in the late or mid 90s, basically, we did get some nutritional education, but it was very technical. So, it was much more this many kilocalories will do this much, and this many grams or milliunits of this is what you need to get. And none of it was very practical. So, we had to learn what we had to do to get through those exams, but it doesn't mean we really learned how to teach you and our patients how to eat correctly and how to blend meals and your diet correctly. So that's getting better. A lot of medical schools are doing a lot better with that nowadays. So that's very encouraging. But if you're dealing with doctors, say from 10 years ago, graduation and beyond, they may not have that better holistic and more practical understanding of nutrition. And so that's definitely, it can be a limitation. It definitely is something that you can work with. But it's something that you just need to be aware of, that not all doctors, and certainly depending on their specialty, don't have that knowledge that, say, a nutritionist has, or somebody who has spent a lot of time, like you, researching this and understanding more of what it really needs. So it's a place where you can definitely work with your doctor, and but they may not know as much as you do, or as much as is out there, or as much as you want them to know. So let me just stop there for a second and see if there are any questions.
Yeah, and I was going to ask you, is the reason a lot of doctors are good with formula is because it's kind of that technical, everything is pre-calculated and easy for them to keep track of?
Certainly. If you have a can or a label that will tell you exactly how many calories you have, exactly how many grams of carbohydrate, exactly how much fat, exactly how much protein, and all of the micronutrients that you want to see, and you can see it right there on the label, of course it's easier for anybody to say, yes, I have checked off all of the boxes that I need to check off to make sure that this person is going to get the nutrition they need. Certainly it's much easier. And also consider this: how much time have you spent learning about a blended diet and how to put together foods to really make that healthy balance? Hours and hours
and practical time too, because right? I've been doing it myself. Yeah.
Right. And I mean, years in terms of really understanding it in a very fluid manner to be able to do it on the fly, in terms of add an avocado or add some spinach. Now, with doctors, we might get about, let's say, 15 minutes to perhaps half an hour total with a patient. And we have to decide and prioritize exactly what we're going to be talking to that patient and that family for that period of time. And so, because nutrition is such a wide topic, and it will take so long to get into all of the appropriate details, it's a lot easier, I hate to say it, for a doctor to just say, hey, everything is in this can for you. Don't worry about the rest of it. Again, they don't want to say that it takes too long, but it does. It's more efficient to be able to just refer to a formula. The other key is, how to tell people how to shop for it. If you can tell a patient or a family, go ahead and just go get this crate of 24 cans and keep them coming, you're set.
Covered by insurance usually, yeah.
Covered by insurance, exactly. And so, but if you want to try to say, here are all the different kinds of foods to go and get, make sure you have this balance, make sure you have, this proportion of the proteins and the fats, it definitely takes a lot longer. And you know that you're setting your patient and your family up for potentially more to do, and for some families, more than perhaps they can take on. And so for a physician, you want to make sure that that patient and that family would be appropriate to be able to hear that kind of information before you offer it. And again, before you spend that precious time on it, you want to make sure that, you get to the right things in the right amount of time. And, I'm sure you know this. I mean, there are times when the patient and the family who are dealing with such difficult issues as different forms of feeding and different types of feeding, and then seizure disorder and all of the other attendant issues that happen with these kids and families who have to deal with other things. Sometimes the diet isn't the most the highest priority for them. They're focusing on things like the seizures, like the vomiting, like the weight loss, and that becomes the main topic. And sometimes you forget the holistic view of the fact that the diet is the underpinning of all of that.
Yeah.
And if you don't balance and correct that overall diet, not just, this micronutrient and that medication, but the overall undergirding of balanced diet, then you're never going to get to those single issues. And I think especially, sometimes specialists really focus on one thing and don't think about, the health as a whole.
That's why I always tell people it's really important, even if you are blending, whatever you've got, take it to someone and have them analyze it. And you might be missing just a little bit of fat, a little bit of carbs, and then you'll have a good balanced blend that you can bring to your doctor and say, look, I've reached all my goals. My child is gaining weight. So on the topic of formula, I know you and I discussed this regarding breastfeeding and formula, and how breastfeeding became a bad thing at one point because the formula companies were pushing. So how did formula become so popular? I know when we last discussed, you had a lot of information about this. Do you is there a reason why formula became more popular than food or breast milk?
Sure. Well, there are really multiple reasons, and I would say the first thing that you're mentioning is that it is a product that is for profit, and so the folks who make that product want to be able to advertise and sell their product. And marketing companies and production companies are very efficient at that. So of course that is going to be a part of it. But let's look at the other side of it. There are cases where that's really the only solution. And let's talk about breastfeeding versus bottle feeding. Really, bottle feeding or formula came about when there were problems with breastfeeding, and it could be a multitude of different problems. The milk isn't coming in correctly or enough, or just isn't, or a woman is status post mastectomy and just can't breastfeed. There are a multitude of reasons why breastfeeding just isn't going to work, and it's a totally unfortunate situation. And certainly you could go to nursing or other breast milk options, but if that's not an option for you, or if you're concerned about that, you're going to turn to a product that can as closely represent that milk as possible.
Mm-hmm.
And that's what formula is. It's a close representation of breast milk, as close as it can be for being basically derived from, man-made products. So there are perfectly appropriate cases where either formula for breastfeeding or formula for enteral feedings are perfectly appropriate. And I want to say that, you have to decide, you as the family, you as the patient, have to decide what is ultimately best for you. And we talked about efficiency a little while ago. If really what you need is the efficiency out of what you're doing, pouring a can into the bag and going through the tube, that's a lot more efficient than going and, getting the chicken and cooking it up and putting it with the beans and, et cetera, et cetera. So you really have to think about, what is right for you and when it's right for you. So the way I like to think about it is, keep formula in mind as a backup. Keep it in mind if there's an emergency situation or a time when you cannot do, a more natural diet, and, have it in the background for when you need it. Now, I completely think that when man makes some kind of derived formula of anything, we are not nature. we cannot think about all of the ingredients that went into growing plants and, creating all of the foods that we eat. And so we are always going to miss out on pieces that are not just important ingredients, but important balances, important proportions that make that whole food more important together than it is in its component parts. And let's just talk about fruit for a minute. So fruit is very important because you can get fruit sugar and the fiber out of the fruit. But when you juice a fruit and all you get is the sugar and the fluid and you lose out on the fiber, that can cause problems in the sense of the fiber can really help your digestion in lots of ways.
Lowers the glycemic index of the fruit.
And exactly. And it would increase the glycemic index just by, the fact that you removed out that fiber.
Yeah.
So, when you think about, say, a more production-oriented, pharmaceutical-oriented division of ingredients and then reformulation, we're going to miss out on pieces like that. And nature put together these foods for our bodies on purpose. It all fits together. Our enzymes work with the foods that are out there in the world as they are, not as derived super versions of what they started out to be. And so it is always best to go with natural, organic foods that have the balance that you need or the balance that, who you're cooking for or creating it for needs. So all of those go together to say that, I think there's room for both. And, if you can focus on that healthier, more natural diet, I think you're always going to do better. And, whoever you're making that food for will always do better.
So, that on that topic of the artificially derived ingredients, something like corn syrup is very common in almost every single pediatric infant formula and I should say infant formula and pediatric formula and even adult formulas. They would definitely have a hard time getting all those calories in without the corn syrup because it's a high calorie, low volume item, but it also is artificially derived. So when reading the ingredients of most common formulas, you'll see sugar and corn syrups as the main source of calories. So why are doctors still supporting this type of diet when there's a push to move away from sugar and poor diets? These kinds of diets, a lot of children that I see are vomiting constantly, and then once they get on real food, they stop, and their blood sugars are spiking. Why is it okay in the formula, but if a toddler were to be able to eat by mouth, we wouldn't encourage this type of diet?
Right. So, we already talked about the fact that, of course, the efficiency of the formula and the fact that you can see it's this many calories, it's, this kind of breakdown. So it's easier for doctors to think about it in that way. So that would be the first thing. The second thing is, we live in, two things. We live in a world of evidence-based medicine where at this point in time, if something hasn't been proven, then the medical community tends to think it's not yet true. And the problem with that kind of thinking is you lose out on the things that haven't been well researched, which may be true, but the only issue is they haven't been well researched. So if we don't have certain kinds of evidence, and the best form of evidence in the medical community would be randomized controlled trials or meta-analyses or groupings of those randomized controlled trials, then certain groups within the medical community would say, well, we can't prove that it's true, and so we shouldn't go that direction because we don't know. Now, the issue with that is, what have we proven about, high fructose corn syrup or, the derived types of sugars? Well, we know that they cause a higher glycemic index and that it really doesn't make sense for the body to be able to metabolize them as well as more natural sugars due to that high glycemic index. But like you said, they do pack in the calories. And when you're focusing on something that is, again, separated out from the whole, and the main focus is growth and weight, and that's it, then you focus on the things that will be able to get you to that outcome in the fastest way possible. And so instead of thinking about, the entirety of why we're using this sugar and what this sugar might mean to not only a body, but a growing body, then you sort of lose out on the whole picture and whether that's actually the best way to go. There's conflicting evidence. I mean, you can find research out there that says that corn syrup is just fine, and other evidence that says it's not fine. And so we really still don't have an overwhelming amount of evidence to say that it's not the right direction to go, and that's why it does remain in lots of products and is still used.
Would it be appropriate then to give a high sugar, high corn syrup diet to a regular toddler, to an oral eating toddler? I'm just wondering if it would be deemed all right for regular parents to be offered that type of meal.
Well, I think basically anything that is given in too high an amount or too high a proportion is inappropriate and definitely can cause problems. And obviously, any form of sugar in too high an amount is a bad idea for anyone. And lots of reasons: overweight, diabetes, tooth decay, especially for the kids, tooth decay. And so no matter what the form of sugar is, you really want to keep it in the right proportion to the rest of the diet, no matter what. The same thing would be true of the type of sugar. And so you definitely don't want to be using too much of one type of sugar. You want to balance it out. You get your lactose from your milk. You get your fructose from your fruit. You get your galactose from your milk. So basically, you want to have those varied types so that you can get all of those beneficial effects from the different ways. And so when you focus just on one type, which is, a super high potency version of these sugars in that, corn syrup type, it's basically, too concentrated, too much already in one sitting. And so over time, it will have likely even greater effects.
Yeah.
So again, to think about it in other words, one of your videos demonstrated, a bottle of Coke or a candy bar compared to Pediasure, and that was a great demonstration. And sure, you're going to give, your kid a candy bar once in a while. They like it. They want it. They might want a little Coke. That's okay too.
I forgot to mention that the candy bar had just as much protein as the Pediasure with the nuts in it.
Right, exactly. And so again, you've got to think about it as a whole. You've got to think about what's going on for that day for you, what's going on for your child or your loved one who may want to have just a little bit of fun with some chocolate. That's okay. We can do that once in a while. We just have to put it in proportion and make sure the rest of the overall diet is a healthy balance.
Awesome. So if anyone has any questions for Dr. Miller, the number is 415-496-9245, and please text us, as I don't have the voice call set up, and or otherwise I will just continue asking her a million questions. So one of the biggest concerns parents have is getting approval from the medical team for a blended diet. Now, I know we talked about why they're not approving it, but can you, as a medical doctor, talk to parents about how they could potentially get approval? I always say, get your blend nutritionally approved by a dietitian or nutritionalist. What other things can they do?
So that's a great point. And let me go back to the reasons why doctors may feel uncomfortable with a blended diet or a certain kind of diet, if we're talking about the ketogenic diet or something like that. It really comes from probably a lack of understanding. And so the more that you can share information that is clear and concise with your doctor, and the more that they can understand what you are proposing, the better your conversation will be. And a lot of times what will happen is we have certain terms that we will use. So if you are very familiar with, a low glycemic index diet, then you know exactly what you're talking about in terms of what a glycemic index is and what certain foods are on that index. But somebody else who hasn't studied it as well And certainly doctors could fall into this category. They just don't understand exactly what you're talking about. They might recognize the term, but not exactly what it means. And so providing your physician and your healthcare team that kind of information, like you said, from a registered dietitian or someone like you, very knowledgeable in the blended diet, and understanding how you can sort of fill in that understanding for a physician from the medical perspective, especially if you can give them some of those terms like it gives a balanced amount of protein, healthy fats, and carbohydrates, the better they will understand it. And I believe that most doctors, the better they understand what you're proposing, the more they will be willing to work with you on it and feel better about you doing it. And I'll go back to, the fact that doctors are people too, and, they have concerns about what the outcomes are for you or for your child. And we, especially here in America, we live in a very litigious society. And there are folks who want to sue you just the minute, you make one step to the left. And so doctors are very concerned about that. And they always have to think, if I don't have evidence of this patient going the right direction, and that could be weight gain, it could be growth, it could be some kind of developmental milestones. If those aren't going the right direction, they will feel like they are in jeopardy of some kind of other, sorts of action. And so they have to represent to you, to other folks in the health industry, and in documentation that everything is going in the right direction at every single moment. And if something starts to go in the wrong direction, they need to recommend some kind of change, or else they will be seen as somewhat negligent. And it's just a horrible setup for our society, unfortunately. But, we have to be honest with the fact that that's what doctors are working with. So I have an idea. We were talking about getting all of that great information from folks who are knowledgeable in, especially, blended diets or ketogenic diets, certain kinds of diet that you think will be right for your loved one. And what you can do is provide that information to them. But you know what? Doctors and lawyers, they really like contracts. And so if you want to set up a contract that states that you understand the risks involved with going on this certain kind of diet, and you understand that there might be things like early weight loss in transitioning on this diet, and other sorts of things that you may be aware of that your doctor may not be aware of, but you can put into writing for them to make them feel better about the risks involved with those issues happening, and then you sign off on it, and you get them to sign off it, and they get to keep a copy. I tell you what, they'll feel a lot better about doing that with you.
I also think it'd be a good idea for parents to do their research initially. Print up, you can email me, veronica@blenderizearound.com, and I can email you some medical journals, and you can print those up for your doctor. You can come with a plan, show them how you're going to transition your child, give them a package, everything you need. Reach out to people within our blended diet community to ask them how they did it. I've got many articles written. Once you bring everything to the doctor will feel more safe that you know what you're doing. And then the contract. That's actually a really good idea. I like that.
Yeah. And I'll give you one other little tip. The journal articles are great. Definitely make sure that the abstract is clear on the article itself. Usually the abstract is a shortened summary version of that article, and it's right in the beginning part of the article. Mm-hmm. You want to make sure that's included in your document, and that the conclusion of the abstract really highlights what you're trying to show. Because I'll tell you what, most doctors, again, they don't have a lot of time to be going through this. And I'm going to be honest, I don't know if a lot of them are going to read the full article.
Yeah.
So if that abstract is clear on the front page, and you can highlight that conclusion section, and you can say, look, this is where it shows what I am trying to tell you, and then you restate it for them so they can hear what you're trying to summarize, I think you'll have a lot better interaction with that doctor. Yeah,
and I always say, don't get upset with your doctor. Even if they say no, ask them what they need to get a yes. Exactly. And then once you know what you need, you go ahead, go forward with what they need. So,
and one other thing I would suggest is ask them why.
Yeah.
Say, why do you not want to do this? And when they tell you, well, it's because I've heard there's weight loss, or because I don't think all the right nutrients are in it, you can address that particular fear of theirs directly.
Yeah. If you have any questions for Dr. Miller, it's 415-496-9245. Please text us your questions. So moving on, so let's talk about children that have G-tubes. Many of them are special needs children, and a good portion of them are on the low end of the spectrum for weight as far as their percentile. So could you give these parents any advice to help with weight gain and dealing with doctors that put pressure on these parents?
Yeah, and it goes back to what we were talking about before, that doctors are very focused on the outcomes, and one of the main outcomes they have, especially with children, are the growth curves. And when you plot out a child on a growth curve and you can see they're following the growth curve, everybody feels better. So, what we have to remember is the kids with special needs, the kids that have, other things going on, and particularly when you have a G-tube, everything is different. Everything is different. And so first off, you have to remember, obviously, the digestion is different. It's not going through the mouth. It's not going through the stomach. It's not getting all of, the digestion that it would have in the upper part of the digestive tract. And so it's just going in through the G-tube. It's going to be metabolized differently, automatically. So first of all, you have to think about that. Second of all, you have to think about, what does this child need? Why do we think that this child needs to be a certain weight when they have completely different needs and a completely different life than other kids? So again, it comes back to, I don't think the medical industry has enough understanding of what is needed for all of these different types of people, all of the different kids with their different needs, to be able to say what they need. And so they superimpose what we know about especially normal children, and then sometimes, some subpopulations that have been studied, and they superimpose that knowledge onto anyone else. Mm-hmm. And it's the easiest thing to do because it's the only evidence-based information they have. So again, it's a matter of discussion with your doctor as to, what are they concerned about? Why do they want to focus so much on weight and perhaps not on seizure control? Or why do they want to focus only on the growth curve and not about what is a natural, healthy diet that's coming with all of those good nutrients, as opposed to corn syrup and, 1, 2, 3, 4, 5, 6 ingredients? So see how they feel about it, talk to them about it, and see if you can help them understand your perspective of how you want to provide your child what is healthy and what is right, and not focus on that one number or on that growth curve. And again, that discussion may help, that kind of contract with them understanding and having in documentation that you're not going to hold them responsible for if your child goes a little off that or a lot off of that growth curve, because a lot of kids, go way off the growth curve. And, I had to deal with families that are concerned about that too, when I have to show them, that for one reason or another, your child is not following the growth curve in the same way, but look how happy they are. Look how active they are. Look how you two, parents are, and how you're a little bit different from the rest of the world. And that's probably why your little one is going to be different from the rest of the world. And that's okay. You just have to think about it in a holistic way, and how you fit in with, the way this has been studied and what is right for you and your family at that time.
Perfect. Thank you. I'm going to see if there's any, there are no questions. You must be answering everyone's questions. So this might be a tough one, but I would say every single one of my clients has been able to go onto real food without any issues. I do have parents that have a lot of issues, and it requires a very fine-tuned blended diet with metabolic disorders. But are there any disorders, or is there ever a time where formula would be a necessity?
Well, we talked about it a little beforehand, and that was, when we're talking about when there's no other option. Mm-hmm. And, let's just say, I mean, in terms of being able to provide a blended diet, let's say the child was in a location where you just couldn't blend, you don't have a blender, then of course it would be necessary at that time. And other kinds of reasons where you're, say, transitioning or something like that, where you just need to use it for a short period of time, then there are metabolic disorders that require that a certain nutrient or a certain set of nutrients be provided. And some of those fatty acid disorders would be some of those where the body just does not create it and you need to get it. Now, does it have to come from formula? No, it doesn't have to come from formula, but sometimes it's easier coming from formula to get the high amount you may need for whatever loss that is. Mm-hmm. And so I would say that there is probably never a time where only formula is of absolute necessity. There would always be a place to be able to add a natural diet in as possible, but you may need to either have a higher proportion of certain foods that would provide those certain nutrients, or it just may be easier to get those nutrients in some kind of gel or purified form that you could then either add into the blended diet or on their own, so you could get the extra of whatever that is.
And just to let people know, if there is an emergency, I do have files in the Blenderized RN file section in our Facebook group for emergency blends and blends that you could just shake together. There's a lot of baby food out there that you could buy that has almost a whole meal in it, and you could just squeeze into the G-tube that you don't need to blend. So there's lots of options out there. That was a great answer. And we still don't have any questions, but I do have a question from my Facebook group, from a member of the Facebook group, and she says, I am a 54-year-old gastroparesis patient with a J-tube. I want to do a blended diet. Would it be possible? And just to give you a background, Dr. Miller, that a lot of people do a blended diet through the J. It just requires a lot more filtering.
Right.
But a lot of people do use the J-tube for blended diets.
Right. And you just stated the key. You have to think about where that tube is coming into the digestive tract and what is possible in terms of digesting that food material at the point at which you're introducing it. And if you're missing out on, the enzymes from the upper part of the digestive tract, and you're missing out on, the pancreatic enzymes and things like that, then you just have to think about what you need to add in based on where it's being introduced. So certainly it would be possible, but again, you want to work with you or appropriate registered dietitians who can help you out with adding in those extra components that you might need based on the fact that it's a J-tube. So now I'm not going to go into exactly what all of those things are, but luckily there are ways that you can get again more purified, more granular forms of the nutrients that you need to get, and also introduce other enzymes into either the blend or introduce just through the tube feeds that can help balance out for any enzymes that you may need to break things down. And so certainly it is possible. It might take a little more research, a little more work to set up exactly what will work for you and how to set that up over a long period of time, but certainly it's possible.
So for that person, I'd just like you to know that there is a webinar that I made called Blended Diet for Digestive Health, and I do go over the digestive enzymes needed for a blended diet and what you could be missing out on, and overall how digestion is affected by either the J-tube or the G-tube. So make sure you look at that. So I'm going to check real quick if we have any more questions. Otherwise, we can finish. And yeah, I don't have any more questions. I know that there were a lot of people excited to see you, and they were mainly asking how they could convince their doctor to switch over and about the ingredients, the corn syrup in the formula. Thank you so much for joining me. I'm so happy that you did this, and maybe we could do this again in 6 months or so, and maybe there'll be some more questions for you. Make sure you make yourself a pot of bone broth.
I know, right? Bone broth.
Because that's what we do in blenderized RN.
I know. I've seen it.
Yeah. And I guess I don't have any more questions for you. I will definitely let people know if you decide you have time to do this again with us. And then like last time, they could just email me the questions. And thank you. And do you have your radio show on still?
I'm not doing my radio show right now, but people can go to KatrinaMillerND.com and just see what I'm doing, and that's a good way to find out.
Oh, wow, I didn't know you had a website. And just so you know, as a medical doctor, parents who don't want to switch to, they want to be on a blended diet, but they don't have the time to blend, and the easy portion, you said how easy it is to just pour a can. There is a company called Real Food Blends that makes real food blended diets in a shelf-stable package that hospitals are now carrying, many hospitals.
Oh,
and
nice.
Doctors just need to order that. So if you see another patient with a G-tube, I don't know how often you're doing clinical practice, but Real Food Blends, just write the prescription, Dr. Miller.
Okay, I'll keep that in mind. Thank you, Blenderized RN. It was great.
Thank you, Dr. Miller. Have a great day, and we'll talk again.
Okay, take care.
Bye-bye.